Thank you so much, Godfrey. October is Breast Cancer Awareness Month, and today we are going to explore different types of breast cancer screenings with our next guest, Mr. Dr. Muneesh Sharma, the Director of Imaging Services at Doctor's Hospital. Oh, I bet you can't say that 5 times fast. Good morning, Dr. Sharma, and welcome to Bahamas at Sunrise.
Good morning. Thank you for having me here.
It is good to have you. So let's get right into it. Could you tell us a little bit about the purpose of imaging services in breast cancer detection, please?
Yeah. Fortunately, the breast cancer detection aims to find cancers as early as possible. There are women who do self-breast examination and they're very aware of their breasts, and they may be able to pick up cancers fairly early. However, a lot of women, unless they get screened with imaging studies such as mammograms or ultrasounds, will never be able to pick up those cancers at an early stage. So the attempt here is to use imaging to pick up cancer as early as possible, and that's where the role of imaging is critical as
Yes.
opposed to self-breast or a physician breast examination.
Oh, yes. So can you tell us a little bit about what is a diagnostic mammogram?
Right. So, like I mentioned, sometimes what happens is a lady is able to palpate a lump, or a physician is able to palpate a lump. That's one scenario. Or sometimes they may come with distinct complaints, such as discharge from the nipple, or painful breast, or an asymmetry between the two breasts. And in scenarios like that, what we are running on the mammogram is essentially a detection not just of the cancer or a pathology which explains the patient's complaints. So that is a diagnostic mammogram in the sense it has certain additional views and certain additional tweaks to a routine screening exam that makes it distinct in the sense that it's able to diagnose the pathology which caused the patient's complaints.
Okay.
On the other hand, a screening mammogram is something where you are normal and you have just walked in to screen the two breasts, and we are just aiming to find a cancer at the earliest without the patient having any complaints, obviously.
Understood. Can you tell us what is ultrasound imaging and when would a patient require that service?
That's a very common question, and especially because women are being aware of the breast cancer and the risk associated at a much younger age. So the challenge here is essentially a mammogram is a radiation in using tool. So an average mammogram will is equivalent to about 7 weeks of background radiation or natural background radiation, which is equivalent to in medical terms around zero point 0.4 millisieverts. Now, the substitute for that in patients who are not eligible for a mammogram, which is under 40 years of age, is to use breast ultrasound. So, ultrasound is a distinct modality. It uses the ultrasonic waves to create images. It's not as sensitive as mammogram because it does not pick up microcalcifications, for example, which are essentially small calcium deposits in the cancer. But it's able to pick up a lot of other pathologies as well. So, mostly an ultrasound can be thought of in two ways. In women who are not eligible for screening, you want to use this as a screening tool, yes. But those who are eligible for screening, the ultrasound is a complement to the mammogram. It adds value post mammogram. It's also of a lot of relevance in women who have dense breasts because
Can you tell us,
the yeah,
not to cut you off, but since you mentioned the
right,
dense breast, like what does it mean when you say a woman has dense breast tissue?
right, right,
Yeah.
right. So the breast is essentially composed of two main components, right? The one is the fibroglandular stroma, which is the one which is the active part of the breast, which produces milk, has all the cells and tissue, which is actively involved in the functions that the breast serves. The other part of it is the fatty tissue, which is kind of a more of a volumizer and stabilizer and support tissue. So between the two, there can be a difference in density, which we see on the mammogram.
Okay.
But every person has differential breast tissue. So there may be a lady who has a lot more fibroglandular tissue and very little fatty tissue, as opposed to someone who has a lot of fatty tissue and very little glandular tissue. So because of that, we see a difference in density between the two breasts. So one with a lot of fat tends to look like a more grayish, blackish breast, and the one with a lot of glandular tissue looks like a lot of white on the breast on a mammogram. And that actually, the amount of glandular tissue, when it is very dense or what very white, it's a problem because it can sometimes masks small cancers, or maybe things may be hidden just under it, but it's not apparent because of the overlapping tissue. So that's the challenge with dense breasts, and we usually like to complement an ultrasound to enhance the diagnostics.
How important is early detection? We want to hear straight from the doctor. And how often is it recommended for you to get a mammogram?
Early detection absolutely is very critical in this whole game of cancer detection and treatment. If you look at the American standards now, they're aiming to pick up cancers as early as 6 millimeters. So that's a very small size which they're trying to. Right. On an average, screening mammogram usually picks up cancers around 1.4 centimeters. So we are looking at going like 50%, shaving that percentage that low. The aim of that reduction in cancer detection is the early or the smaller the cancer is, the less likely that it has spread, first of all, to other body parts, especially like lymph nodes in the axilla or other glandular tissue in the neck or diffusely in the body. So your chances of metastasis or spread of cancer are lower, as well as the ability to cure by removing just the cancer is higher. So you're able to get more curative treatment as opposed to a palliative treatment when the cancer is smaller.
Thank you.
So definitely, the aim of all cancer detection techniques is to find the smallest possible site as it can be. That offers the best prognosis for that patient.
Yes, thank you so much. Can you tell us what promotion Doctors Hospital is offering for breast cancer this year so that persons can connect with you?
Definitely. We are very fortunate to be offered the opportunity to pass this on to the Bahamian public. Our exec decided to offer two components to it essentially this year, which is very different from what we do previously. So on the mammogram front, we are able to offer a cash pay price of $60, which is a flat price. Almost a 50% discount, essentially, because a routine mammogram is 120. So that is a significant reduction in cash pay pricing.
And if
you're insured, then the co-payment is waived because we just take what the insurance provides for that. But not to complement that, this time we have actually also gone down on the breast ultrasound prices because a lot of women need complement imaging. We are offering breast ultrasounds at $250, which is also a significant reduction from the routine price of $350 for the breast ultrasound. So I think together it's about a 33% reduction in breast imaging, which I think a lot of women will benefit from. And it's something which I would really want to push out to the public to take advantage of, because all we want to do is pick up cancers at the earliest and offer curative treatments to patients who are unsuspecting.
Thank you. Thank you so much, Dr. Sharma. Today we were just talking with Dr. Sharma, of the Director of Imaging Services at Doctors Hospital. He was telling us about the importance of getting a mammogram, having an ultrasound done, and just the importance of early detection. Thank you so much for having you on Bahamas at Sunrise. We'll be right back.
Thank you.